Hi, my name is Dr. Grishko, and I'm a dentist at Willing Smile in Implant Dentistry. Just let me tell you a little bit about myself. I was born in Kiev, Ukraine, former Soviet Union. I went to medical school in Kiev, Ukraine, and unfortunately I didn't have a chance to graduate. They tried trying to immigrate to the United States, got stuck in former Soviet Union due to deterioration of relations between the United States and former Soviet Union, and we were stuck there for quite a while. After the army, I went to dental school in St. Petersburg, Russia, and I came to the United States in 1991. In 1996, I have graduated from Western University Dental School, and I started my own practice back in 1997. Really, a reason of my presentation today, if you can call it presentation, is that after we started posting certain of our cases on the Facebook, I got a bunch of questions from people, from patients and their relatives and friends, because of these confusions related to different aspects of dentistry, mostly specifically related to implants and implant supported restorations. Before I get to that, I want to say that I would say 40% of our time, or 40% of our treatments, is kind of surgical, which is, difficult wisdom teeth extractions, just extractions, bone grafts, implants, implant supported crowns, implant supported prosthesis. Besides that, we do regular dentistry, we do crown and bridges, we do crowns, we do onlays, we do certain aspects orthodontics, which is correct or Invisalign, basically invisible braces. We do periodontal treatment, we do a lot of laser gum treatment, which is called LANAP, but I'm not going to go to details of all the treatments in this presentation. It's just going to take forever, and usually, at least for me, if I see the clip which is more than 15 minutes, length, it should be really good clip, so I would, I would watch it. So I'll just kind of get to questions or issues that I encountered due to people misunderstanding or not complete understanding anything related to implant treatment. Okay. First of all, for a lot of people, implant it's equals to the tooth. Well, it's not true, because basically implant, I want to sound too simplistic. Implant is basically, it's like a screw, high-end, high-quality titanium screw inside the jawbone, and nothing more. For that to become a crown, for that to become a tooth, you need to have a crown over that implant. So when we're talking implant, we have to understand it's when it restores, saves or restores the tooth, replaces the tooth, we have to have an implant, and over the implant we have to have a crown, so it becomes fully functional tooth. There are different kind of implants, there are different brands, and I'm gonna get to that, and it's not really the major point of the whole thing. Some implants better for certain procedure, in other implants better for different procedures, just two small details. You can have one implant, you can have two implants, you can have 3 or 4 implants, next to each other, different parts of the mouth, but we are referring to them as single implants. And what they have in common is they need to have a crown, to function as a tooth. The process usually is, once tooth is out, implant is placed. After it integrates with the bone, usually 3 months, you can have, crown done over that implant, and you have a functional tooth that you can smile and chew. Okay, and it's irrelevant to a single implant or 2 implants or 3 implants, doesn't really matter. One of the biggest issues, biggest confusion that I've encountered was then when people are missing teeth or about to lose whatever teeth they had due to whatever reason, maybe gum issues, rampant decay or whatever it may be. So they need a replacement, they want to eat, they want to smile, they want to go on with their lives, they want to be happy, they want to be presentable. There are basically, I would say, 3 modalities of that whole treatment. because upper and lower dentures, they don't usually stay well because there's nothing to hook to. There are no teeth, there is no clasps, there is no nothing. And usually though upper denture is considered to be usually a little bit more stable, and the lower one is kind of unstable due to the function of the tongue, cheeks, floor of the mouth. And I don't know, over the years, long years of doing dentistry, I've seen really few people who are happy with complete lower denture. Usually they're extremely unhappy. And tell you even more, recently we kind of stay away from doing just denture without any implant support, because it's just what you have an unhappy patient down the road, or let's say more or less happy patient down the road, because it still moves a lot. How do you make denture stable, or better question, how do you make a patient happy so he can eat, he can function, he can smile, he can go on with their life, and don't his life or her life just not think about when the denture is going to come out, and not to use glue. That's, I would say, 3 basic modalities. The first one, is you may put like 2 or 3 implants in the jaw. Wait 3 months until implants integrate, and later dentures kind of stabilize to those implants. But at the same time, after it's all done, it's pretty stable. But still, by the end of the day, some patient has to remove it, clean it. As they go to bed, they have to take it out. This few rare occasions when you don't want to take it out. But pretty much that's the procedure. Once implants are in, you have to still wait 3 months until implants integrate. And after that, you kind of manufacture, send it to impression or scan. Actually, this is a digital scanner. You don't have to put anything usually in the patient mouth, and scans being sent to the lab, and lab fabricates the final unit. So the good thing is it's pretty stable, but still you have to take it out and clean and do all that kind of stuff. And there is a certain degree of mobility. Second option is called mini implants. It's called usually placed 4 mini implants, and mini implants, they work, I would say 99.9% on the lower jaw. They don't really work too well for the upper jaw. What it is, that the time of the procedure, kind of a little bit thinner 4 dental implants are being placed in the lower jaw, and at the same time, and again I repeat, at the same time, at the same appointment, certain modifications are done to the patient denture, and it's denture clicks on those implants. We call them mini implants, mini because they're kind of smaller, just they're thinner. Positive thing about that procedure is that patient leaves the office the same day, so-called, as people say it, with teeth. So again, they can smile, they can eat, they can be presentable, they don't really have to worry about the fact that the denture is going to come out in the middle of the dinner and so on, or at the date, or whatever the situation may be. Drawback is still, like in the first case when I said that 2 or 3 implants, just 2 or 3 regular implants, still there is some degree of mobility. Not a lot, but there is some degree of mobility. Actually, I encountered kind of different situation, because I had a lot of people complaining that it's too hard to remove the denture, which is stabilized over those 4 mini implants. I kind of said that she remembers like smiling, like, wait a second, I think it was an idea that's gonna be, kind of hard to remove because you want to be stable. But again, I say this is a semi-joke, because everybody can remove those things. It just takes a little bit of practice, but you basically take 2 fingers and pop it out. It can be cleaned. I mean, you have to clean it, you have to take it out when you go to bed. Well, again, I'm sure there are cases when you don't want to take it out when you go to bed, but we are not getting that thing during the that presentation or that clip. Okay. Again, I want to stress out, and with the mini implants, the advantage is that the same day you walk out of the dental office with teeth, and you can smile and eat and be happy and presentable, teeth-wise. And the last one, and actually I should not have the last, shouldn't have done the last one, I should have started maybe with that thing. It's called, concepts called all and X, okay? Originally, it was developed by Brenemark, and it was called Olin 4, but Olin 4 it's called just when you use specific implants, and it's just, again, it's not really relevant. The bottom line, and some other people call it FAIR, full arch implant restoration. Whatever you're gonna call it, FAR or Olin X, doesn't really matter. What it is, let's say teeth have been extracted at the time of the appointment, or patient had no teeth and they had bad dentures that didn't hold. In any case, between 4 and 6 implants are being placed in either upper and lower jaw, and there's the denture that's being manufactured, made specifically for that appointment. And after implants are placed, denture is modified certain way, so it's being screwed, denture is being screwed on to those 4 or 6 or 5 or whatever implants that the patient knows. I just kind of make it too simple, modified, because process called conversion. Usually it's either dental lab guy comes to your office, or if you're lucky like me, and I have Irina Bim, who used to be a lab technician in Russia, actually I'm sorry, Belarus, and she's very handy, and she can just do miracles. So I'm lucky that I don't have to do that, though I know how to do it, but like honestly I've done it in my practice maybe like 2 times out of God knows how many we've done. So in that sense I'm very lucky, and I'm very, very grateful to her for whatever support she provided over the years. So at the end of the appointment, the denture is modified, it's called conversion, and being screwed on to those 4 to 6 implants. But it's not a permanent unit, it's transitional, or people will call it temporary. I don't like it called temporary because I don't know, everything's temporary in this world. Let's call it transition unit or temporary unit, whatever. I'll try to show pictures, some x-rays, but believe me, it looks very good. After 6 to 9 months after that appointment, after implants are integrated with the bone, you can do the permanent unit. And permanent unit is very different from the transitional or temporary. Why? Because it's made from the zirconia. It looks awesome. It has porcelain teeth. It just really looks great. And again, permanent one is being screwed on to those implants. So you have 4 to 6 implants supporting this, that unit. Some people call it bridge, some people call it hybrid, some people call it dentures. Very hard for me to say it. I would say it's mostly like a hybrid. Why? Because it looks like a bridge, but at the same time it has some elements of the denture. I don't think it's that relevant. Just it looks good. People can eat. It's not coming out. If you sneeze, it's not gonna come out. You don't have to remove it when you go to bed or go on cruise or whatever. You don't run a risk of losing it. Kind of a little bit maybe of the drawback is it's kind of not hard to clean. It requires some effort to clean it. And usually, from my experience, I know that usually people are very compliant with something that can be done very easily. That thing is not hard to clean, but still you have to put some effort. That I would say about all those treatment modalities. So a couple of implants support the denture. Next step is 4 mini implants, and again I want to stress out that it's just at the same time patient walk out of the office with teeth and with the denture basically supported by those 4 implants, and just ready to rock and roll, if you can say it. And the last in line was, though it's not the last one, actually the first one, it's doing 4 to 6 implants, procedure which is called OLNX or FAIR, full arch implant restoration. Same story, patient walk out of the office with teeth in their mouth, and when the integration takes place, just final unit is being produced. I mean, this is very broad overview, but I think it should give clear idea what's beneficial, what may be not beneficial for different people who have different desires, different abilities, different state of health, and so on. So it just can be decided by the patient. Like sometimes people ask me, Doc, what do you think is best for me? I was like, I don't know. I mean, I can give you the facts. I think I can tell you what I could do for myself, for my parents, or for my relatives, but the decision is yours. I just can provide you with facts and just how it would work, but it's your decision to make, not mine. I can get to more details, but it's going to be really boring or may not be boring. So if anybody has any questions or whatever, just send me a message and I'll be more than happy to cover it. If like, a lot of people asking the kind of similar questions, I'll be more than happy to make a different presentation. Let me just show you a couple of cases in the computer showing different modalities. So I just thought like I just kind of told you a bunch of stuff, in this presentation, but doesn't really show, like just kind of trying to give you an example. I'm just a little bit constricted in time. I can just maybe do different presentation to show more, but just kind of give you an idea. Okay, for example, actually, okay, here it is. What you can see on the laptop. It's a scanner. What it does, it scans the patient mouse. We used to do the impressions before. We would put something in this patient mouse, some kind of material, and it would capture the shape and form and whatever it is. Some people, other people didn't like it because it just kind of restricts their airways a little bit. Just they don't like the taste of that thing in their mouth. So it was replaced by the scanner, and it gives pretty good idea about. You can see what it is. So in this particular case, you can see teeth. Gum, pink, now we have some tartar, and you have 4 implants here. Somebody had 4, apparently, actually I know who, and somebody had 4 implants on the upper left side. So actually it's a very cool unit. In this particular case, I know whose case is that. Okay, here you can see a bunch of, if I may, as I say, Jessica, my surgical assistant. I wouldn't be able to do much without my assistants, Irina, and there is another assistant, Hala, but she's not here today. Maybe she's going to be present at different presentations. So I just don't sound like it's all my achievement or whatever. I wouldn't be able to do anything without their help. So anyway, so here you can see the final result. You can see 1, 2, 3, just multiple pictures. 1, 2, 3, 4, 5, and 6. There are 6 implants, and basically it supports it all an X affair case. It's a little bit unusual case because that lady I placed 2 implants long ago. Eventually she implants stayed, but she lost other teeth, so I kept those 2 implants, placed 4, and she ended up having altogether 6 implants that support that all an X thing. Can you show us the picture? Just it's not really that important, but if you can show the picture without the final, without the final thing, just implant, implant itself. Just click it again. Let me see. Maybe I can show that picture. Hold on a second. No, it's the same. No, it's all the same pictures. It's the same. Okay, actually, I don't really want to spend too much time showing it. I want to show the picture before, we did the bridges, which would be for like 4 implants. But again, you have an idea. There are 6 implants, and there is a final thing on that one. Okay, the next patient. Let me show that lady. Just type in that lady. So that's the case I just showed you. It was 6 implants, all an X affair that supports, in this case it was a complete upper, she would have otherwise complete upper denture, but she has that, all an X affair thing, that she has that thing, the unit just screwed to the implants, and she's very, very, very happy. Okay, I was not really getting ready for that presentation in advance, and just kind of was done, decided to do this morning. In this case, like 3 implants, 1, 2, and 3. Now, put a better picture. You don't see completely that implant. In this case, she only needed 2 implants. I placed 3. Third one was pretty much no charge. The reason was that those 2 implants are going to be stabilizing complete lower denture. That one was placed just in case, if she wanted additional support, or if ever anything happened to one of the implants, she has a backup plan. So that was like basically scenario number one when people have two implants that support the denture. Okay. Later she had attachments, those, and she was pretty happy with the with the final outcome. Okay. And now just that guy, his name is I think Yuri, like my name. I'm gonna show you case, though I don't like the word case because case is like something doesn't human to that. I want to see the patient because I say word case and it's not really correct in my opinion. Anyway, there's a bunch of pictures. Just don't be confused by that. In reality, somebody has only 4 implants. It's like 1, 2, 3, and 4. You can see balls, kind of ball type attachment on those implants, because the actual denture, is being stabilized certain way due to those ball attachment on the implants. It's just like 1, 2, 3, and 4 implants. We have different pictures. They kind of show a little bit better. So, for example, on that side, you can see this is the one on the right, center. There's one on the left. Pretty much, it's just kind of repeat of that. But again, there are 4 implants, and they support 4 mini implants, and they support complete lower denture, which is notorious for being loose. Being honest, in this particular case, the patient, he had just a little bit wider mini implants, but a different size. He had the widest mini implants available because his bite was pretty heavy, and I thought it's gonna be much better for him if he has a little bit wider implants. So actually, those implants are not really that far from the thickness of the thin implants. Anyway, it came out pretty good. He was very happy, and that's all I can tell you about that. About that patient. So this is for mini implants. It's a case that I was describing when everything's done in one appointment. So you come in the morning, and pretty much in the evening you have you're happy. Well, I don't know. It was kind of brief or not brief presentation. Maybe I'm not sure if it was boring or informative. I try to do my best. I can cover other area. Is going to be any whatever suggestions, messages, or whatever. So, I'll try to do my best. The only thing is it's kind of, disclaimer. Often patients ask me over the phone or when they see me in the store anywhere, doctor, how much is going to cost that, and that? And the answer is like, I don't know. I can tell you the benefits, everything. In order for me to say it, I need to have x-rays, I need to see CT scan, I need to see the patient mouth, I need to have a patient's chair. It's just very hard to honestly tell, the fee, because it's just impossible. It's impossible. Anyway, I'll be more than happy, and if somebody can send me messages with questions, comments, and I'll try to cover more topics that are interesting for everybody next time. Thank you for your time. Bye bye.